Hi guys, and welcome back to the Stretching Samurai. My name is Patrick Ravel. Today we're going to talk about soft tissue release because it's a major component in fixing any shoulder injury, hip or knee or whatever injury that you have on your body. A lot of times we're going to try to find the problem, find a correlation to the problem and the associated symptoms in order to treat an injury. But it's very important to do the soft tissue release to get full benefits of your rehabilitation. So today I'm going to give you some simple guidelines to using a very famous tool that's going around all the gyms and all the companies, which are activator balls. Okay, these balls are very popular. People call them double lacrosse balls. I like to call them activator balls because this is probably one of the best set of massage roller balls you can get on the market. So when you're using this for soft tissue release, you need to understand that before going for the injury, let's say the injury is in the rotator cuff, you're going to want to work in the front and in the back, okay? So what you're going to get oftentimes is soft tissue restrictions in the front, and in the back you're going to get those hypertonic muscles that are hurting, that are long and weak, and oftentimes fibrotic due to overuse because of the loss of that rotator cuff. Okay, so it's very important to release the front and the back of the injury to make your injury go away and the rehab more beneficial when you're training. Okay, so how do we use the activator balls? Well, number one, it's important that you understand that you need to roll on the front and the back of the associated injury in a superficial and deep way. And also you might want to change the pattern of your rolling. So let's say I've got an injury on that shoulder. I know that my upper fibers of my pec major is tight. I'm going to use, let's say, these massage roller balls, and I'm going to do first cross friction, okay? So you're going to take the balls and you're going to cross friction that pec major. So cross friction is pretty much going side to side, just like this, and you're going to go side to side for 1 to 3 minutes, okay? And you're going to go superficially and not too deep because you don't want to damage or bruise the muscle itself and the fascia, and you're just going to go just like that. You can do it with your hands, but oftentimes I'm going to go against a wall. Okay, so we're going to start with cross frictions, and after, what I'm going to do is I'm going to continue in an angular pattern, and I'm going to change the pressure. So instead of going like this, I'm going to go angular, and now I'm just going to go with a deeper strokes inside of that muscle going towards that shoulder. Okay, so that's going in an angular pattern. And finally, I'm going to go straight in line, and I'm going to go up and down long strokes in line with a much deeper release. And I'm going to do this each one for 1 to 3 minutes. And I'm going to try to hit all those fibers around that area. And this should be done around aphasic or atonic muscles and with care, guys. Now, it's very important that these guidelines are very simple and they work, and around 10 minutes and you're pretty much done and you can start doing your rehab. Now, very important, I'd like to mention, there are a lot of companies out there. TRS makes the best double massage roller balls because you can actually feel that the material has a little give, and also if let's say you want to do spinal release, like I've shown you on my video, basically spinal decompression, the center to center of the ball is roughly around 3 inches, and it's very comfortable to go up and down the spine, especially around that rhomboid and levator scapula area, which I love a lot. Now, if you're using the more Chinese brand, and it's more of a cheaper brand, because these are going to be around $40. These you can get for about 10 bucks, but they're very hard and they have only 2.5 inches in width, and they're going to hurt. They're going to be closer to the spine or closer to the injury. So depending on how much money you want to put, maybe I'd put an extra $10, $20 to get TRS's activator balls, because this is actually fantastic. The material is great. You can put it in the fridge, freeze it, and after maybe do a cold compress on that injury. It's even better. So guys, I hope this helps you a little bit. It's a quick tip to release soft tissue around a shoulder problem or a knee or a hip. And please subscribe, guys. I love having you on my channel, and I'll see you soon. Ciao.